This is a podcast by the Straits Times.
Perimenopause is the transition period before you menopause, right?
Your final menstrual period.
Yeah.
Yep.
And what is the age range for perimenopause in Singapore?
Peri means around the time of the menopause, and this can happen when the periods start changing, and periods changing is a reflection of hormonal change. Most women maybe 4 or 5 years before their final menstrual period, but in some women this can even start from early 40s for some women. So it's very hard to actually nail down when the perimenopause starts, because it's when the woman notices her periods are changing and then having symptoms maybe like hot flushes, night sweats, etc.
Hello everyone, welcome to Health Check. I'm Joyce Teo. Today we're diving into a topic that so many of us either don't talk enough about or just don't know enough about. That's perimenopause, the period before menopause. Many people miss it until they're very near or in menopause because they may attribute their symptoms to aging or stress. So today we're going to unpack everything about perimenopause. How do we know that we are in it? How long it lasts? What other surprising things about perimenopause that people should know about? And how you can better navigate this phase. My guest is Associate Professor Rukshini Puvanendran, the co-director of the KK Menopause Centre. She's also the head and senior consultant of the Family Medicine Service at KK Women's and Children's Hospital. Prof. Rukshini, thanks for joining us today.
Hi Joyce, nice to see you, and thank you for inviting me.
Right, so you've been caring for women for almost 15 years now, right?
Yes.
So are you surprised by just how much misinformation or lack of awareness there is around perimenopause?
I think in our traditional Asian society, especially probably a generation or two ago, women didn't really discuss perimenopause. It was kind of something hushed up. And I think many of our mothers probably didn't discuss this with their daughters. But women do share that they remember their mothers becoming a little bit more exhausted, a little bit more irritable towards their late 40s and 50s. And there was some change in their mothers, but it's not something that they actually talked about. So if you don't learn something from your family, then who do you learn it from?
You mentioned mothers are, they seem more exhausted and irritable in
40s and 50s, which is usually the kind of perimenopausal period. So sometimes you can see women just kind of so-called change a little bit. It could be because of the symptoms. For example, I think the very classical symptom of menopause is vasomotor symptoms, which is a heat. And this heat can affect your sleep if it happens at night. So if you don't get good sleep, you'll be more tired, more exhausted, maybe more irritable. Perimenopause is due to a reduction or change in hormone levels for a woman. The most important female hormone is estrogen. So as estrogen level starts going down, symptoms like vasomotor symptoms, which are hot flushes, and if that happens at night, it's called night flushes. Additionally, there's a lot of evidence to show that actually hormones affect a woman's mood. So for example, we are very well aware of maybe postnatal depression, which has got to do with hormonal changes and mood. And women just before their menses can also have mood changes. So something similar happens in perimenopause. When the hormone levels are changing, it does affect a woman's mood. So they can be feeling a little bit more maybe up and down on the moods, a bit more depressed, maybe a little bit more anxious. And this is something that a lot of women in their 50s share. In fact, there are studies that show that women are saying, I just don't feel like myself. There's been a change. I don't know what's going on. Sometimes they don't really associate it with this hormonal change.
Right. Perimenopause is the transition period before you menopause, right? What is the age range for perimenopause in Singapore?
Okay, so menopause per se is easy to nail down because basically it's a definition of when a woman stops having her period, or we can talk about the final menstrual period. And definition of menopause is 12 months without a period. In Singapore, it's about 49. Worldwide, it can vary because different ethnic groups have different age of menopause. Peri means around the time of the menopause, and this can happen when the periods start changing, and periods changing is a reflection of hormonal change. Most women maybe 4 or 5 years before their final menstrual period, but in some women, this can even start from the early 40s. So it's very hard to actually nail down when the perimenopause starts because it's when the woman notices her periods are changing and then having symptoms maybe like hot flushes, night sweats, etc.
So when it first starts, that means there will be changes in your period.
Usually, one of the early signs is, like, say, a woman has regular periods every 4 weeks, and the periods start getting either lighter or heavier or maybe less frequent. That kind of slight changes. That itself is actually an indicator of underlying hormonal change.
Okay, that's interesting because you mentioned that one of the myths is that people think that the symptoms only start after your period stop. So actually, women can look out for changes in their period.
Yes. I think the average woman doesn't really look at her periods she may forget. Some women are very good. They actually keep a track or a diary, but a lot of us don't. So you may not kind of correlate the change in period with the symptoms. And what may hit you is, hey, suddenly why am I feeling so hot? Is it Singapore's getting hotter? Is it something else going on? Why am I having difficulty sleeping? Why do I keep waking up at night? And I feel really hot. So that could be one of the first symptoms. But, women may just feel a little bit different. Maybe their sleep is lighter. They may just feel a little bit more anxious. Or, mood changes are there. Or just feeling like they can't cope sometimes. Yeah.
Right. And how long does the process last, right? I mean, perimenopause, you mentioned 3 to 5 years. Menopause can be...
Okay, menopause?
One stage? Yeah.
Yeah. So once you have a final menstrual period... then you're in menopause for the rest of your life.
Oh, I see.
Yes, because estrogen levels have come down, you're not having a period, so technically
That's considered menopause.
Post-menopausal, meaning you've had your menopause, and that will be...
That's it. That's your life. That
means
stage. Yeah.
Yes, so Singaporean women are now living, I think average age is about 85, which means if we menopause at 49, you do the maths, we're probably spending more than 1/3 of our lives in menopause.
That's a long time. Do the symptoms last that long?
Okay, so there are different symptoms. So vasomotor symptoms for the hot flushes, etc. As I mentioned, it happens due to hormone fluctuation.
Okay.
But by the time you hit menopause, the hormones have come down and they're fairly stable. Okay, but saying which, I must make a caveat here. A lot of women, even in their 50s, who don't have periods, can still have hot flushes and night sweats because hormones are still fluctuating. It's just that they've gone to a level where they're lower than being able to produce a period. But they're still going up and down, up and down. It's just that the graph is getting lower and lower and then stabilizes. So that's when the hot flushes stop. And we have women even in their 60s who say they're still having hot flushes. But that tends to settle through. And sometimes it could be just very mild and, they kind of, okay, I'm having a hot flush. It's okay, I can handle it.
60s and
into
your 70s?
No,
okay.
70s, maybe not, but 60-ish.
Okay.
Then, of course, there's the other kind of symptoms of menopause, like, for example, we call it vulvovaginal atrophy or genitourinary syndrome of menopause. So this happens where there's dryness of the vagina, and that's really because of lack of estrogen. And the estrogen doesn't come back. So that symptom would probably last. When you say menopause, certain symptoms are just going to be there because the estrogen lacks. So some of the symptoms are due to estrogen fluctuation and other symptoms are actually due to the total lack of estrogen.
I see. I suppose women with these symptoms would be the ones that you see at the KK Menopause Centre, right?
Yes. We've been having a menopause clinic for many, many years. But in October of 2023, we realized that, women in Singapore, we are having an aging population. We need to cater to women who are getting older. So we made it a center. So in our center, we have doctors who are gynecologists. We have doctors who are family medicine specialists. We have mental health, mental wellness specialists, as well as dermatologists, and access to other therapies like sports, exercise, dietitian, etc. So we realized that it's not just about the periods. There is much more to it. And we therefore thought, yes, it's good to have access to multi-speciality practice.
So what are some of the common problems that you see in these women coming into the clinic?
Typically, because I think most doctors would be aware of hot flushes and night sweats. So that tends to be our typical referral. And our referrals are from either within KK itself or from outside, like, other specialists or the polyclinics or family doctors referring in. And that's our typical kind of patient. But saying which, there are many other symptoms of menopause. So sometimes women have mood changes, they're just not feeling like themselves, poor sleep, etc. So they also get referred in, and then the doctor really has to kind of dissect out, like for example, poor sleep. Poor sleep could be due to many things. It could be because you're having hot flushes and you can't sleep at night, or it could be because of anxiety, could even be because of pain, or it could be because I'm going to the toilet all the time, or I can't sleep because actually I'm in pain. So you really need to dissect out everything. And of course, there are other kind of sleep disorders like obstructive sleep apnea, restless leg syndrome, etc. So you really need to dissect everything out. So insomnia itself is quite complex. Okay, so there's that amount of evaluation to be done. Then, of course, as I mentioned earlier, painful vaginal, genitourinary syndrome of menopause. So that's another reason why women come in. But increasingly, I think doctors are also realizing that there are other symptoms. For example, a fair number of our patients actually end up seeing a cardiologist because one of the symptoms of menopause is palpitations or an awareness of heartbeat.
Oh.
Okay, so typically when you have a palpitation, typical medically, we are taught that your heart rate is going very fast. But you could actually have more of an awareness of heartbeat. For example, recently I had a patient who herself was a doctor, and she's actually very health aware. So she suddenly started having this heartbeat very fast. So of course, went to see her friendly cardiologist. So she actually measured her heart at that time. And during that episode, her heartbeat wasn't very high. It was about 65, 70, which is perfectly normal. But she had that awareness of her heartbeat. So when she went to see the cardiologist, they had a full cardiac evaluation. And actually nothing wrong was the diagnosis. And she was like, what's wrong? What's happening? So then we have been talking to cardiologists, and he said, hey, maybe it's menopause. So she actually came in and, we discussed it. And interestingly, what happened was she was also having hot flushes, and she decided to go on hormone therapy and for the hot flushes. And she said, that palpitation disappeared. So again, these are kind of subtle signs of hormonal changes.
Right.
And it's good that, at least the cardiologists are now more aware of it.
Yeah, but that's interesting. Is that common though, this awareness?
Quite common, this awareness of heartbeat.
Yeah, because it's not actually going up, right?
Yeah,
but you're just that you're
That's
aware.
Right. You're aware of it and you're wondering what's happening. Am I having a heart attack? But actually your heart rate is perfectly fine. Especially, I think nowadays, because of the fact that people are actually using wearables and able to actually measure, they're realizing, okay, my heart rate's not high, but I'm feeling it,
That's interesting. So why is there this awareness? So everything is heightened, right? I mean, like you could be more allergic to certain things.
That's right, yeah. So a lot of women do say that they start having a lot of rashes, skin dryness. That's not uncommon. Again, it could be part of the aging process, or it could be part of the estrogen reduction itself. Okay, so it is, as you mentioned, very important that women are aware of these and start using less strong soaps, for example, because you're itchy. What do? We think, must clean it more, and then it just makes the whole process worse. So kind of, using more moisturizing soaps, using moisturizers that are more for dry skin, so that kind of self-care and how we are caring for our bodies also will have to change. And so hair does get thinner and drier. It does affect the person because, nowadays women in our 50s, we're all working, we're kind of out there. So these things do matter to us.
So if you're in your 40s and you're wondering whether you're in perimenopause, is there any test that people can do, to track their estrogen levels?
Yeah, so good question. The problem is actually because the hormone levels are fluctuating. So we really don't know if we're going to catch it at the right time. Because the hormone, the estrogen levels are going up and down, and then there are other hormones that are also fluctuating. So sometimes if you just do a blood test, it may not really give you very much information more than the symptoms themselves. So there are very specific times that we do these blood tests. Hormone blood tests are available, and we really do them if a woman comes in with no periods or what we perceive as menopause, but she's very young. Okay, so for example, the 38-year-old says, hey, look, I haven't had a period, I'm not pregnant, and we do these tests mainly because we want to see if she's in menopause. And I just want to bring it out here that the normal age of menopause is at 49. So if a woman has a menopause early, unfortunately, this can adversely affect her health because the hormone estrogen is very necessary for our bone health, our heart health, and now even cognition or brain health. So if she's going to be in early menopause, we really need to get the diagnosis, and usually we will treat her with hormone replacement therapy until the time of natural menopause, age of 49. There's a lot of data to show that women in early menopause who are not treated will have worse outcomes like heart disease, strokes, osteoporosis, fractures, etc. And therefore, these women should be treated. So that would be kind of the times that we would do the blood test.
Oh, right. And since you talked about early menopause, what's the age range for that?
So there are two conditions. One is a condition called premature ovarian insufficiency, and that's defined as before 40. Okay, but we would kind of diagnose maybe early menopause at 45 and below. And if you come to our center, we will do some evaluation because each woman is different. So definitely below 40, she should be evaluated and treated. The 40 to 45 is a bit of a gray zone. So we may do certain tests because not every woman is the same. So for example, like she's maybe 44. So we do evaluations, including things like checking their bones, checking etc. Now, if they are actually in very good health otherwise, that's fine. You don't need any treatment. But if we find that, their bone densities are lower than their peers, then we would treat.
Right. But it'd be a good idea for somebody below 45 if your period has stopped completely to actually go for a check.
Absolutely, yeah. Is it really menopause or is it something else? Or, and if she's in menopause, does she need treatment?
Right. Because, the risk of diseases, that's kind of scary actually.
Absolutely. And I think that is unfortunately something that women are not aware of because they say, oh, it's okay, I don't have my periods anymore, I'm fine, But they don't realize that they are more likely to fracture, they're more likely to have heart disease, and even dementia risk is there, especially it's been shown before 40. If they're not treated, it's a worry there.
At what age would all these problems come on if they're not treated?
Okay, so usually maybe 10 years after. So for example, at 40, if you have your menopause, then maybe by 50, 55.
That's young, yeah.
Yeah, absolutely. But again, things like, for example, bone health, that's very, very well established. Bone health is complex. So your bones will depend maybe on how much milk your mom drank when she was pregnant with you and how much calcium was in your diet, for example, as a child.
Right.
And Asians, unfortunately, we don't take as much dairy maybe as Caucasian population.
Yeah.
So we are, and also we are thinner, so there's a complexity to it where you put on medications that may have thinned out your bones. How much vitamin D do you have? So there's a complexity to it, but one of the risk factors is early menopause.
Right. So actually, when you're in menopause, your aging process is accelerated,
That's right. In a way, that's kind of what happens.
Faster than men.
Yeah.
Not fair.
Yeah, men are kind of lucky. They kind of have their hormones go down as well, but it's a gradual decline. Unfortunately for us, our decline is much steeper.
Right. What can we do, right? We're going to talk about it, and that's the important part, right?
Yes.
About what women can do about their perimenopausal symptoms.
Okay, so I think most important is number one, being aware of what's happening. Like you're having hot flashes, what's happening? Just education, understanding the process. And for majority of persons, depending on what the symptom is, it's just kind of understanding what's going on and lifestyle measures. For example, let's just talk about general health. So number one is food that you eat. Like a lot of women tend to put on weight during the menopause, and that really bugs them. They'll say, look, weight is just at the tummy. I'm just like putting on a lot of weight. With weight, unfortunately, comes things like diabetes, hypertension, etc., even joint pains, etc. So one thing that we could do is like prevent the weight gain by just kind of keeping an eye on our weight. And that comes down to diet and exercise, meaning, you may need to cut down the amount you're eating and eating less processed foods, eat more lean protein, vegetables, etc. Then, of course, exercise. You're going to start losing muscle, losing bone. So for bone health, exercise is important. The other thing is what I talked about, calcium and vitamin D. So during the menopausal period, because of this hormonal fluctuation and reduction, we lose a lot of calcium. And that's when the osteoporosis process starts. So it's important to make sure that we're getting enough nutrition for our bones.
Oh, I see. So would you advise people to take a calcium supplement then?
So it depends on how much calcium you're taking. We probably need about 1,000 to 1,200 milligrams calcium per day. And the studies that show the average Singaporean diet only about half of it, probably 50% of what's required. So you could either more mindfully eat foods that are rich in calcium. Dairy would probably be one of the most rich in calcium. But unfortunately, a lot of Asians actually lactose intolerant. So in those situations, again, things like maybe sardines, ikan bilis, all these are high calcium food. But
or oat milk.
Yeah, well, see, calcium-enriched oat milk.
Oh,
yeah.
okay.
So please go and read the labels. Like even soya milk must be calcium enriched because soy itself is actually quite low in calcium. So ideally, of course, you're taking the calcium from from food. But if you are really lacking in that, then probably a calcium supplement.
But how would we know, right? Because you don't really check.
Might want to just be careful with what you're eating. Just be more mindful about what you eat because it's not easy to check. Even blood calcium doesn't really tell you anything. So it's just kind of looking into what you're eating. So that bit's important.
Right, but what's the harm if you take a supplement and you take too much of it?
Okay, if you're taking a supplement of 400 to 600 milligrams, it's fine. But you should not be taking too much, like 1,000 to 1,005 or 2,000 milligrams. So again, in the supplement, it depends on how much you're taking. Generally, 400 to 600 is quite safe. But of course, it's always better to take from a natural source.
Right. You should start taking it during your perimenopause stage, right? You were saying.
Yeah, earlier, because that's when you're going to start losing it. Right. But definitely by the time you hit menopause, be more mindful about the calcium. And the other thing, of course, is vitamin D. Because surprisingly, a lot of Singaporeans, we live in a very high sunshine country, but
we're an air-conditioned
nation. Yes. So we're in the air condition, we all hate the sun. And unfortunately, perimenopausal and menopausal women are so worried about having melasma. They'll be walking around with an umbrella, using a lot of sunblock, When we do bloods for our patients surprisingly, we're quite low on vitamin D. So that's another thing that we might want to even look into. We've got the food, the exercise, and then it's important to do general exercise, but also kind of muscle building, body weight, functional training, etc. Because we are going to lose muscle, so we need to keep ourselves strong. Because as we age, falls, etc., can happen. So just think of yourself now. I'm going to be 70 years old. Do I want to be a strong 70-year-old or do I want to be a weak 70-year-old? So what you do in your 50s is going to make a difference where you are in your 70s and 80s.
Right. Weight training.
Absolutely. Yeah. But women don't seem to like to weight train.
Oh, yeah, that's right. Because it's hard work, right? Yeah, and it requires equipment as well.
Well, you could even just take 2 water bottles and lift them. There's many, many ways, even like stretch bands, with push-ups.
Yeah.
Lady push-ups.
But there's no easy way, right, for this kind of stuff.
I don't know. They haven't come up with the drugs at the moment. It's, you got to put in the work. But, generally, the other thing about exercise, it kind of brings out the happy hormones as well. So a lot of my patients, myself included, when you exercise, you feel better, you feel stronger. And that's the other thing I just want to talk about. Sometimes the mood can also be a bit lower during the perimenopause. It could be multifactorial. It could be the hormones themselves. But also, 50 is that age when the kids are growing up. Empty nesting, maybe you may have lost somebody close to you. There are many, many things that can go on. And even your relationship could have some kind of friction. So kind of looking into that and also looking at how we can keep ourselves stress-free, managing ourselves, mindfulness, etc. So looking at stress management and then sleep, extremely important. And as we get older, we don't go into as deep sleep as we do when we are younger. A teenager can sleep through an earthquake and can't be woken up. Whereas, you're hitting 50 and above, like sometimes 70, 80-year-olds, they are like saying, hey, look, I can't sleep. I'm not sleeping. The tiniest noise will wake them up. Mm-hmm. And that happens. It happens as part of aging, but sleeping is extremely important. People actually say sleep is when our brains are being washed and clean. We need our sleep. So prioritizing our sleep in terms of, good sleep hygiene, trying to sleep at the same time every day, avoiding kind of blue light, etc., TV, screens, avoiding anything too exciting before bed, taking something relaxing, avoiding caffeine, etc. What we call sleep hygiene. That's very important because that's all for your general health. So what you eat, how you move, your management of stress and sleep.
The usual, the things that we should do, but a lot of people don't.
Yeah.
But short of this, are there some new solutions that have come, to help people women with menopause?
Okay, so it depends on the symptoms. If they're having vasomotor symptoms, meaning hot flushes that are quite bothersome and they've tried lifestyle, menopause hormone therapy would be the most effective first-line treatment for this because underlying issue is change of hormones, so you just replace them. It also is effective for menopause-related mood disorders. For example, like say a lady is quite affected by hormones, for example, postnatal depression, then you know that, she's quite vulnerable to hormonal fluctuations. And this may also be due to the perimenstrual mood disorders. Some ladies, their moods are more fluctuating before their periods. So that means that she is vulnerable to menopausal mood disorder.
Okay.
In fact, I can quote a patient. She said it was when she became a little volcano of rage around her husband and daughter, who then started avoiding her, and she knew she needed help. The mood swings and anger were my biggest problem. Things would come out of my mouth before they even crossed my mind. And I would really feel bad and almost wanted to cry. And she says taking the hormone therapy really helped to reduce these symptoms and enabled me to keep enjoying life the same way as before.
So how long would you advise people to go on HRT?
The data shows that it's generally safe and the benefits outweigh the risk for women under the age of 60, given within 10 years of the menopause. So in my practice, when a woman is started on hormone therapy, we do some basic checks. And if she's suitable, we will start her. Usually I'll review her 3 months later. And then after that, it's every 6 months to a year. And every year or so, we'll have a discussion. How would you want to stop? You don't want to stop. So we'll do a trial of cutting down and see if the symptoms come back. If the symptoms don't come back, fine. But if the symptoms come back and she's keen to continue, we will. But we will do the monitoring. So she will need to be monitored by the doctor.
For the risk, the side effects of it.
Okay, so basically, most of the time with hormone therapy, the sleep is better, the flushing is better, the mood is better. So when we look at side effects, one of the things that women worry about would be breast cancer. Okay, there are two types of hormone therapy. One is estrogen alone, and the other is estrogen plus progesterone. So for a woman who doesn't have a womb, it's estrogen only. Okay, but a woman who has a womb has to go on estrogen plus progesterone because the progesterone kind of protects the womb. So estrogen alone will cause the womb to proliferate, but when you give it together, they balance each other out, and we don't have a problem there. So estrogen alone on data, looking at studies, actually doesn't increase the risk of breast cancer. Okay, but the estrogen and progesterone done in a study, it's almost 30 years ago, a study called the Women's Health Initiative. Now, that was an interesting study because they actually took women between the ages of 50 and 80 and started them on hormone therapy. Now, in practice, we never start somebody at 65 on hormone therapy. Usually, we start them early in the 50s. So this was a bit of an unusual study, but in that study, they showed that women who are on the combined pill, if they used it for 5 years, there was a 1 per 1,000 increase in breast cancer. That means one woman out of 1,000 women had an increase in breast cancer compared to the placebo. So there was that worry. But actually now what's happened is they have followed up these women. So 2017, they actually published a paper on what's happened to this group of women. The ones on hormone therapy versus the ones on placebo. Interestingly, there was no statistically significant increase in breast cancer death in the two populations. What they did find is that the women who were on the hormone therapy for 5 years lived longer, lived better, had less risk of heart disease, stroke, and cancers than the group that was on the placebo.
I see.
Especially those in the 50 to 60 age group.
Then shouldn't women in general be on HRT then, given that you said once you reach menopause, you're in this stage for the rest of your life, right?
That's an interesting question and an interesting discussion. Generally in medicine, we tend to say if you have a symptom, we give you a medication. Okay? And therefore, the symptoms are vasomotor or hot flushes. We know that it's menopause-related mood disorders, maybe osteopenia, lack of bone, and vaginal dryness. So those are the 4 indications. And those are quite well established, and no doctor will argue about that. Then when it comes to preventive, it's a different story because we maybe don't have enough data. Because it's quite different to treat a person for symptoms versus treat a person for preventive. So the bar has to be higher. And unfortunately, even though that study showed it, we have not had another large-scale study to look into that.
Okay.
Because studies do involve a lot of money.
That's true.
And funding.
But that will be interesting, right? Because, you start your aging early and anybody will want some help in slowing down the aging process.
Nah, that's the fountain of youth that everyone is searching for.
Yeah, but we all have to age somehow. So we're going to come to the end of the podcast. So just wanted to ask you, we talked about myths earlier, right? What is that one myth that you still hear, after all these years concerning menopause or perimenopause?
Maybe it's just that, as I mentioned, menopause only lasts for a couple of years. So sometimes they just think that this is it and I'm okay. But as you mentioned, aging does carry on and hormonal changes are part of it. So I think in terms of lifestyle is very important and it's got to be something continuous.
Yeah, now that you mentioned this, because you say that the symptoms can last typically 5 years after menopause, but some of it lasts forever, right? Because you're in this stage, right?
Yeah.
So if somebody who's listening to this podcast is 60 or 65 and then they're having some of the symptoms, would you advise them to go for HRT?
Okay, so for example, one that a lot of older women suffer from is the dryness of the vagina. And that also leads to maybe increased infections of the urinary tract because the vagina and the urinary tract are very close to each other. The other thing women also do suffer is incontinence. So a lot of women say they kind of wet themselves. And local vaginal estrogen is actually very safe. And it helps to reduce these symptoms, which can be very uncomfortable. So vaginal dryness, of course, is uncomfortable for the woman, but also sexually, she can be very worried about having sex because it's painful and she can even bleed. So what happens is she starts avoiding her partner, having a bit of PTSD with sex, and that can cause a lot of rift in the relationship.
Yeah. You were talking about vaginal dryness, and then you said you can use a cream, right? Instead of taking an oral tablet.
Yeah.
So does the cream have a lower dose of estrogen?
Yeah, it's a much lower dose. And you just apply, and it's even weekly. You don't need to use it daily.
Okay.
And it's quite effective.
Right. Okay. I think that people will feel much better if they're worried about any risk of breast cancer.
Yeah. Or a little tablet in the vagina. There's an applicator, so we use a little applicator to in. So I think that is something that I'd like to get message out. Vaginal dryness, or we call genitourinary syndrome of menopause, which has to do with the vagina, the urinary system is treatable.
And can they get that treatment at a GP or do they have to go to the menopause
I suppose
center?
they could go and see their family doctor first and maybe they can evaluate. If it's very straightforward, definitely they can start the treatment. And then if the treatment is fine, that's all they need. But if they need further evaluation, they can send them to KK hospital.
Oh, I see. So you can actually get this cream at the GP, right?
I think the polyclinics have them for sure.
Oh, okay.
Yeah.
Maybe not the GPs.
They might. For sure, the polys have them. And I'm sure most GP practices would have access to it.
So it's not something that you need to go and see a specialist for. Right.
So I think if we can even just send that message out,
Yeah.
that would be quite good.
Is there an age limit for that? What if you're 70, 75?
Yeah, actually, remember, the underlying issue is it just gets worse and worse, right? I mean, I've got 90-year-old patients who are still on it, and they say, look, when I'm on it, I'm fine. When I'm not, it hurts, and I wet myself, and I really want to have a life.
Okay, I hope people will listen to the end of the podcast for this, because I think a lot of people don't know that there's help, right? Or maybe they don't even dare to,
Yeah, that's the other
raise.
thing. Absolutely. I think it's something women are shy about, understandably. They don't want to bring it up to their doctors. Sometimes doctors, it may be a bit awkward, especially if you're not familiar with taking a history, and other things like sexuality, just asking, are you still having intercourse? Is it painful? Something simple question like that. Sometimes the patients actually feedback and say, I would like it if the doctor asked me, but I'm too shy to ask myself, So we've been running a public forum for the last more than 12 years. Okay, it's usually very well attended. We have it in October. There is a World Menopause Day. I think this year it's on the 18th of October. It's usually on a Saturday afternoon. And we have a series of talks, and we also have workshops.
In person?
In person, yeah.
Sounds good. Prof. Rukshini, thank you very much for sharing your insights with us today. And I hope we've made perimenopause a little less mysterious.
Thank you, Joyce, for inviting me.
Well, that's a wrap for Health Check, a podcast series by the Straits Times. Don't forget to follow Health Check for free on your favorite audio apps, Apple Podcasts and Spotify. Like us and give us a rating. This episode is edited by Amirul Karim. Thanks for listening.
Send your feedback to podcast@sph.com.sg. Find us on Apple Podcasts, Spotify, or within our Straits Times app. Thanks for listening.